The first state of the state, we came together with a program to try to reduce the number of underweight babies. And we have been increasingly successful in that. Tens of thousands of babies have been born full term. And that represents significant progress. With Medicaid expansion, we've now signed up somewhere around 176,000 176,000 women who would not have had health care, any kind of comprehensive health care, without having done that. Now, Terry and Shannon, we're going to renew Medicaid expansion in the legislature, aren't we? Terry? Nothing can get in our way on this, Terry. No, I'm serious, folks. Look, I got a lot of you here today. If that thing is at risk, we're going to be marching. You got it? We're going to march, and you're going to show up because we got to get this done. Okay? Now, we made some progress, and we have more progress to go that we're going to push through the budget. But the other day, when they came and said, here's what we're going to do with the budget, I said, okay, the budget is going to take some time. What can we do today? Today, not tomorrow, not next week, not next year, today. I would say by and large, from what I know, and maybe I'm not right about this, but by and large across the state, we're having success in the area of having healthy babies born. But what we know through this mapping project, which was another one of these initiatives that took time, see, they went out and statistically figured out the hotspot areas in our state. By the way, if you're doing it right, your guardian angels out there in the community. What we know is that there are 9 communities with 26 hotspots where we have an absolute crisis. And I don't want to wait to try to figure out what more we can do. So today we're announcing that everybody who is located in those 26 hotspots, located in those 9 communities, will immediately be available for all health services for people who are defined as high risk inside of those communities. Everybody is automatically able to be signed up and be available to the services that are provided for those people who are at risk. So now, instead of having a 2-step process where you've got to go out and find them, they're eligible. And now we have the full-scale healthcare services available for all of them. Even at an early age, even if they're in a position of where they are not currently pregnant, but it's going to be up to you to guide them to the proper places to make sure that they get what they need, because if we wait until they're pregnant, it's too late, right? So we got to get on it now, and we're counting on you. The other thing that we're going to do is we're going to fund, and a lot of it is connected to the senators that are here today. We think that there is a great prospect in being able to gather the people who are, sort of like they're able to gather in a group and help each other to get through the difficult challenges that anybody has. My wife, who's very interested in this, said last night, for these folks to avail themselves of services, are we going to tell them to quit smoking? The answer to that is yes. So we are going to fund a couple pilot projects here to see that if we gather women who fit inside that criteria in a room and let them work and help one another to understand what it is to be treated appropriately, properly, and to have a healthy baby, we're going to fund several of those initiatives in the state. Now, longer term, we want to make sure, now some of the plans, the provider plans, are already involved in terms of having boots on the ground in these hotspot areas. But not all the plans are there for a variety of reasons. So what we're going to work on now is to make sure that you are fully integrated with the plans, so that the caseworkers of the plans are embedded in the community and fully integrated with you, the community people that have the credibility with the folks that live in the community. That will come in the budget. It's going to cost us some money. And by the way, money doesn't grow on trees. So we have to figure out which things are working and which things are not working, which leads me to the social service agenda. We are now trying to work on welfare reform. You know, the idea of Medicaid is not for people to stay on Medicaid all their lives. The idea is to get them off Medicaid and get them into a job, to eliminate the cliff that prevents some of our folks from being able to get ahead, because if they work an extra hour and make more money, they lose their child care, and we got to get rid of that, and we're working on it. But what we really want to do is the model that I've seen, and I think it works. Anybody here from Lincoln County? Okay, we've got a tape right in the middle. It was like this was planned. Here they are. But in Lincoln County, we have turned what I like to call an emergency room into a full-fledged hospital when it comes to welfare. What we want to see happen is when you have to get your food stamps, your general relief, or whatever it is you're getting, you show up to an office. But also in that office is a training program. A training program that involves government money, but as they do in Lincoln County, also involves money from the business community. So we get people trained for jobs that exist. And in Lincoln County, they have had 90 people hired at a 90% retention rate. And it just is, it's a terrific thing to see. Now across our state, we want that to happen. We want to make sure that our work boards can make sure that we're training people for jobs that exist. Here's the problem. Doesn't that sound great? You get your help, you get your training, you get a job. Sounds great. But you know what happens? Sometimes our egos get in the way. Sometimes turf gets in the way. Sometimes we go, well, that's, I don't want to do it that way, or I've done it this way for 40 years and I'm not changing. A social service system that does not deliver results must be changed. It makes no sense to pour more money into a system that isn't working. So we're going to need you to be involved and to help us in that as well. The ultimate goal for everyone, healthy babies, mothers who people care about, every individual having an opportunity to rise and fulfill their God-given mission. Now, I'm just not talking to you about it. Yesterday, I talked to about 200 of the most powerful CEOs in America. And I told them about their responsibilities. I suggested to them about their responsibilities in terms of being involved in the welfare office and being involved in mentoring. Folks, these challenges are so big, but they involve precious life, our children, our babies. So for all of you, let's not think about the results here based on hitting a home run with the bases loaded or running 90 yards down the field for a touchdown. Every yard we gain, every single we hit, changes some other life. And over here at the Holocaust Memorial that sits on the State House grounds, it says if you save one life, you're changing the world. And when you go home, you got to realize how special you are. Now look, if you're tired and worn out, then get out of this, because you're not doing your job. You got to find something else that's going to get you pumped up and motivated. But if you love what you're doing, even though it can be so darn frustrating, right? So difficult, so challenging. You feel like you're in an ocean of problems, a tsunami of problems that wash over you. But every life you change makes a difference. And I tell you what, it's what I happen to believe. Every life that you change, every effort that you make is recorded in the book of life. And someday, when you leave this earth, you're going to be asked a question. What did you do with what I gave you? And you're going to have a great answer. I have no doubt. What do you think, huh?